5,000 of those are in the state of New York. Total U.S. deaths have passed 4,500. New York, 2,373. Again, I start with this because there appears to be some people that feel like when it was in China, that was so far away, it would never happen here. When it was in Europe, it would never happen here. And now there are still some people that believe because it's happening in Louisiana and Washington and not just New York, but all the surrounding states around here, that somehow it can't happen here. But the preparation that we're doing and the mandates and orders we put in place are exactly that, because the virus doesn't discriminate by geography. It doesn't discriminate in any way in terms of humans. And so everybody's susceptible to this. We know that it's more susceptible to people that are elder and with underlying health disease in terms of susceptibility to having this be a fatal disease. But again, we want to launch off by asking that everyone acknowledge and understand the orders that we've put in place, and we're super grateful for all the people that are following those orders. Today, the North Dakota Department of Health confirmed 12 additional cases of the novel coronavirus disease, or COVID-19. Our total for the state now stands at 159 positive cases. As we shared yesterday at this briefing, we're moving from sharing case data twice a day to once a day. And so today's reporting of 12 only is from a very short period. That's from approximately 3 p.m. yesterday, when we consolidated the numbers reported yesterday here at the briefing at 4. And then this includes 12 cases between 3 p.m. and midnight last night. So on a cases per hour basis, that is on a pace that similar to what we've seen on our most number of positives per day. Tomorrow morning at 11 o'clock, we'll be reporting a full 24-hour period again, as opposed to a 9-hour period. So we would expect that tomorrow we'll have a higher number than we had today. When we take a look at that curve again, even with that short reporting period, you can see that the growth in that curve continues to climb up. And as I said at the opening, there are no states in the U.S. where the curve is declining, and our growth rate is lagging. We're 2 to 3 or maybe even 4 weeks, depending on how we flatten the curve, behind other states. And so we're still in the beginning stages of the work that we're doing to try to slow this spread. In terms of what are we doing to slow the spread? It's the same things that we've talked about before, which is about, when we talk about North Dakota Smart, which is stay home, stay healthy, and stay connected. And again, lots of advice out there to follow, but keep hearing from calls that we're having. We had on mayor calls again today, calls with health officials today, calls with business community today. We continue to hear where some people are taking this very seriously and others yet not. And so again, this is an appeal to all North Dakotans who love liberty and freedom, which I think is everybody in our state, to continue to maintain that liberty and freedom. It's very important that we exercise individual responsibility, and by acting in following these guidelines, you are saving lives. The one thing that we did today in Bismarck today on April 2nd was we ordered up a pretty good blizzard today. This was after things started to clear, and you can see the Capitol again on this slide, but I just wanted to report for others around the country that we've done a great job, at least on the outdoor social distancing. We've seen no violations of more than 2 people within 6 feet outside anywhere on the Capitol grounds today, because we haven't seen anybody outside. And if schools were still operating, there probably wouldn't have been a snow day in Bismarck today. So I'm sure there was maybe some kids disappointed they didn't get a snow day today because they had to keep working on their distance learning. But for those snowbirds that are out there that are returning back outside the window of my office today, I did count over 50 robins in a tree that were first robins that I've seen of the year, and they're probably wondering why they didn't stay further south like other snowbirds. So we did see a flock of snowbirds arriving today, and they were not practicing social distancing. They were all huddled together in that same tree, all those robins. we've heard there's a lot of stuff going on social media. We've asked people to be very clear about, particularly with information related to the virus, to make sure that they're getting good information. Some of those calls are based on trying to suggest that the data that we have in North Dakota would indicate that we're somehow putting our neighboring states at risk, or that we're not being responsible by having more government mandated action. And so we just want to run through a few numbers. And the first of all is it'd be good for people to understand what our positive percent rate is. This is the percentage of new cases that come in that test positive out of the tests that we're taking. Today, 12 new cases out of 353 tests. And when I say today, this was just in a little less than a 9-hour period from yesterday between 3 p.m. and midnight. That if we go back and we take a look at our rate for the entire time, the 159 positives out of nearly 5,000 tests, that's a positive rate of 3.2%. We're tied for the fourth lowest of all the 50 states. The only states with a lower rate are Hawaii, New Mexico, Alaska. We're tied with South Dakota and Vermont at 3.2, and Minnesota's rate slightly higher than us at 3.2. Or 3.3%, slightly higher, but we're among the best states. I mean, saying best, meaning in terms of we have a low percentage of positives relative to tests. What does that mean? Does it necessarily mean that we've got less of a spread, or does it mean we're doing a better job of testing? Part of the answer is it means we're doing a better job of testing, and we'll take a look at that next, where we've completed 5.9 tests per 1,000 population, and that's similar to other proactive states that are with high testing and low positives. Utah would be ahead of us, New Mexico at 6.3, Hawaii at 6.3. So again, we're in the top 10, and with the plans that we got in place, we want to stay in the top 10 and keep moving up towards number 1 in terms of really doing a great job on testing. So again, success here depends on slowing the spread of the virus. And if somebody is saying, you know, oh, North Dakota's got more tests per capita than Minnesota, well, we've done almost twice as many tests per capita as Minnesota. So, of course, we're going to have more positives per capita because we're doing more testing per capita. But again, key here is for everybody following the rules about keeping physical distance is the number one thing we want to spread or stop doing. And on that, it was mentioned to me today on one of the calls that in some of our smaller communities or counties where there's no positives reported yet, doesn't mean that the virus isn't there. And if somebody thinks that going to the Senex and having coffee with 9 people, sitting closely together with your old crowd, and you have less than 10, then you're following the rules. No, it's less than 10 people, and everybody that's there is more than 6 feet apart. Or if you're having coffee at the Senex and then you head over to the elevator and talk to a different group of 8 or 9 people, again, you could be in a position where you're a spreader and may not even know it, because again, you can be asymptomatic, meaning no symptoms, and spread it. So again, even in our communities where you may think it hasn't reached you yet, please act as if it's already there, because the data on the testing is at least 10 days behind and also underreports the number of positives. The next thing we want to talk about, next topic, is the COVID-19 Community and Nonprofit Response Fund. We know that many North Dakotans are looking for ways to help fellow North Dakotans during this crisis. And the best way to do that, of course, is to donate to some local organization that you're already familiar with. For example, whether it's a local senior citizen center, or your local food pantry, your local medical providers, you know them, you trust them, you know who they are, and you can donate directly. However, if either they're not able to accept donations, or if you prefer, we've got an opportunity to contribute statewide to the North Dakota COVID-19 Community and Nonprofit Response Fund, which will be hosted by the North Dakota Community Foundation, another highly trusted and well-known organization. A link to this fund is available on our ndresponse.gov website, or you can go directly to their website, which is at ndcf.net. A little more on the North Dakota Community Foundation. It's a 501c3 nonprofit established in 1976. They're very experienced in managing disaster relief funds. Many would know that way back in 1997 that Governor Ed Schaefer asked the North Dakota Community Fund to manage private donations that came in for the huge floods that devastated Grand Forks. And in 2011, Governor Jack Dalrymple asked them to manage the private donations for the statewide flooding that occurred in Minot and other places in those. Today, we're going to hear some brief comments from Kevin Dorock, the President and CEO of North Dakota Community Foundation, who will now briefly explain this process for those willing to contribute. Thank you, Kevin.
Use the back of my hand. Thank you, Governor. Appreciate that. As Governor Burgum said, if you know of trusted local organizations in your community which are responding, they should be your first priority for giving. Unfortunately, in crisis situations, there are those who try to take advantage of generous people like you. So please be aware of any pop-up or unfamiliar organizations that may solicit you. The North Dakota COVID-19 Community and Nonprofit Response Fund was established last week with a lead gift of $50,000 from the North Dakota Community Foundation. If you would like to help, you may give online by following the link for monetary donations at the ndresponse.gov website, or go directly to the ndcf.net website as well. You may also mail checks to the North Dakota Community Foundation at North Dakota COVID-19 Fund, P.O. Box 387, Bismarck, North Dakota 58502. You should know that 100% of your gift will go to the response effort. The North Dakota Community Foundation will take no expenses from your gift. If you have questions or would like to donate other financial instruments, such as stock or mutual funds, please call our office at 701-222-8349, and we'll work you through how to get that accomplished. We are already in the process of receiving grant requests from all across North Dakota, from nonprofit organizations who are helping in this event. The need is great. We will make our first grants from the fund by mid-April. Some of our local community foundations have already made grants in their towns to local volunteer groups who are providing supplies and food to vulnerable citizens, especially elderly and shut-ins. We are in touch with other funders in North Dakota to ensure that our grants go for unmet needs and don't duplicate the giving of others. Any nonprofit organization, government entity, or volunteer group may apply. The first deadline is tonight at midnight. They can apply online at ndcf.net. Assistance to individuals may be provided through our nonprofit partners, but individuals are not eligible to apply directly from the fund. We will get through this together. Thank you very much.
Thank you, Kevin. We're deeply grateful to the North Dakota Community Foundation for taking the lead on this fund and for their lead gift of $50,000. And we're also grateful to all the North Dakotans who we know have got generous hearts and are willing to help contribute to their fellow North Dakotans. We also know that there are many organizations, businesses that have been interested in donating personal protective equipment, or PPE, a new acronym we've all learned, to help ensure that our healthcare workers and first responders are protected as they respond to COVID-19 within our North Dakota communities. Supplies can be dropped off at the North Dakota Department of Transportation's district locations in Bismarck, Devils Lake, Dickinson, Fargo, Grand Forks, Minot, Valley City, and Williston. And drop-off times are Tuesday through Thursday, 8 a.m. to 3 p.m. Donated goods will be consolidated in Bismarck, managed by volunteer organizations, and distributed in coordination with the North Dakota Department of Health. So it's another way of saying if you drop off PPE at any of those locations, we'll get them into the North Dakota Medical Cache, and we'll know how to prioritize to get them out to the local workers that need them. Donated items should be unused in their original packaging and commercially produced. We're not accepting any homemade medical supplies or PPE at this time. And items that can be donated include N95 masks, surgical masks, isolation gowns, face masks, hand sanitizer, alcohol wipes, thermometers. A full list of items that can be donated to support our medical efforts can be found at ndresponse.gov. Another example of our whole of government approach to addressing this COVID-19 crisis, the North Dakota Department of Transportation team members worked with the North Dakota Department of Health this week to deliver hospital supplies around the state. As you may know, we've had even prior to this emergency, had a medical cache that had been built up for exactly this kind of situation. It was loaded with a lot of material, including over 1 million N95 masks. About 40% of that has been distributed of the medical cash out to the 49 hospitals across North Dakota. And this last week, the DOT provided 6 drivers and equipment to help haul that across the state. So as the director of DOT, Bill Panos, has said, this mission is vital for the state to provide the best care for its residents, and we want every hospital to have the supplies on hand to be prepared to deal with the effects of this global pandemic. The deliveries began on Monday, March 30th. They'll continue to be made daily till supplies are distributed. As we rebuild the cash and as needs arise, we'll continue to do that. Next topic. We know people are stressed, and during stress times they feel vulnerable and desperate in some cases, makes them more vulnerable to scammers looking to take advantage of this difficult situation. We're fortunate here to have with us today Attorney General Wayne Stenjum. Consumer protection is one of the many important areas that our Attorney General leads and takes great care in looking at. He's been a great partner throughout this pandemic work, and he's here to talk specifically about what we're doing as a state and what his team is doing to help protect consumers during this time of vulnerability. Attorney General, welcome.
Thank you very much, Governor. And please let me start by doing something you do just about every day, which is to thank everybody for all of the work that they're doing, the thousands of North Dakotans who are doing exactly what they are being asked to do, the things they should do, that they're joining together to help their friends, families, and neighbors. All of our first responders, our law enforcement, people in state government who are working all around the clock to help with this problem. But I'm not here to talk about them. I'm here to talk about that small slice of individuals who see this pandemic as an opportunity to make a buck. Yesterday, I issued a press release, an immediate and urgent press release, because we're seeing an incredible increase in the number of reports that we've been getting from citizens who are getting robocalls or personal calls claiming that they had won the Publishers Clearinghouse sweepstakes. North Dakotans have lost thousands and thousands of dollars. What happens is they call, they tell them, here's your secret number, call us back, give us that number, and we will send you a check. When they do call, they are then told that there's a fee, an expense, some kind of a sum of money that has to be paid in order to acquire your winnings in the magazine sweepstakes. They're all scams. And we have seen people have lost over $10,000 here in North Dakota, and it seems to be proliferating. Once you send money to these scam artists by a wire transfer, a credit card transaction, or any technology transfer, we can't get it back. The only thing that we can do is help to get the message out, and I want to tell you why that is so very important. Just before I came down here, a woman called into our office. She had paid almost $9,450 to a scam artist claiming that she had won the Publishers Clearinghouse. She read in the newspaper the story that we put out saying that these were scams. She called just before she was ready to make the next installment of $3,000. So we can't get the money back, but by getting the word out, we can assure that people don't fall further victim, and that's especially true with our vulnerable citizens who are at home, maybe alone, maybe not in contact with the people they might otherwise rely on. It is illegal to suggest to anybody they have to pay money to collect a prize in a sweepstakes. Plain and simple, illegal. The other scam that we have seen now here in North Dakota is the Grandparent Scam. These scams kind of mutate, just like the flu virus, like the coronavirus mutates. The Grandparent Scam is an age-old scam where a grandchild will call up grandma, a fake grandchild, claiming that they're at the border. They've been arrested for one offense or another. They need money for a lawyer. They need money for bail. They need money for one purpose or another. An alert citizen of North Dakota called our office to report that he'd gotten a call from somebody claiming to be his granddaughter who had contracted coronavirus. He did exactly what we always tell people to do. He hung up. We don't know what it was that was next to be asked for, but you can be sure that he would have been told, I'm in the hospital, I need to make payment on a medical bill, and you have to send it by wire transfer or by credit card or by going down to the store and getting a prepaid credit card. So he was alert, he was smart, he did what we said you should always do, and that's hang up on those calls. The other scam that is going to come here to North Dakota is sweeping the nation already, and that is for those people who are expecting, which is just about everybody, their $1,200 stimulus check or for $2,400 for the family. And these scams are claiming that you need to pay a fee, you need to submit certain information in order to get your check, or they claim that they can help speed things along. And of course, each and every one of those will ask you to pay something in order to do that. None of that is happening. You do not have to pay a fee. You do not have to provide information. The check that you're entitled to will be coming in due course directly from the U.S. Treasury, deposited into your bank account, or in some instances, a check will be sent. You don't need to do anything. There's no intermediaries, and you certainly don't have to pay anybody in advance in order to get it. The next is something that I am familiar with, and that's the fake products, because I've gotten at least a couple of dozen spam emails claiming that they have tests, vaccines, treatments, cures of one nature or another, and that I can get that from these scam artists, and that they alone have the treatment or the cure. I want to alert and assure everybody that you are not going to find out about the existence of a cure when it arrives in a piece of spam that you get. You are going to find it from legitimate news sources. There also are spam emails going out promising masks. I even got one for an oxygen concentrator, whatever that is. If you respond and click on a link, nothing but mischief is going to happen. And if you attempt to buy something, you will at some point have to enter your credit card number and your PIN number and your expiration date and perhaps even your mother's maiden name. And then in exchange for that, you will get an inferior product, or more likely, you will not get anything at all. And what you will have done is given your credit card information to somebody who can use it for purchasing whatever it is these con artists want. The cure doesn't exist. There are no lotions, potions, nostrums, or snake oil that exist that you can get from spam email that you are sent. Ignore it, delete it, and never, ever, ever click on a link in those pieces of spam. And then finally, I just want to touch on the issue that's been brought up before, and that's the charities. In America, we're very generous people, and in North Dakota, even more so. But if you're going to give, I hope you will give generously, but you also need to give wisely, because there no doubt will be all manner of scam artists coming out trying to claim that they are a legitimate charity or that they are somebody who can get money directly somewhere. Don't ever respond to somebody who calls you on the telephone asking you for a donation to a charity. What I do, and I do this without fail, and I suggest everybody else do as well, is I tell people I never do business with donating money with anybody who calls me on the telephone. Send me something in the mail. Every legitimate charity will send you something in the mail if you ask. Accumulate what it is that you've been asked for, and then sit down with your spouse or significant other and make an intelligent decision, a wise decision about who it is that you want to give to. Charities are suffering, and their contributions are certainly going to decline just like everybody else's. And so make sure that you're giving wisely, or give directly to people that you know. It doesn't have to be through a charity. People you know that are suffering and have difficulties, help them out. Be as generous as you possibly can. but make sure that the donations that you're giving go to places that are going to actually do the kind of good that we're all talking about. You outlined one here yet today, so for those who are unsure, that's a good spot to donate as well. Check with the North Dakota Secretary of State, by the way, the sos.nd.gov. Every charity that solicits money is required to be registered. And so check to make sure that they are actually registered in North Dakota. So thank you for the opportunity to come and give this information to assure people that, that we're here and we're ready to work and do whatever we can to help. And I think here, if you get a robocall or a scam call or anything asking you to do donate money, especially in the Publishers Clearinghouse, please call 1-800-472-2600 and we will talk you out of it, and we will save you a lot of money if it's something that you're considering donating to. So thank you, Governor. Thank you very much for having me come here. Please, it is essential that we get the word out. I told you about what happened with the lady who, only because she learned in the media, we saved her several $1,000s. Who knows how many other people we could similarly assist by getting the word out. Thank you.
Thank you, Attorney General, and thank you for all the work that you and your team do to help protect North Dakota citizens. Usually I'm looking at the camera and I don't get a chance to see Lindsay behind me while the Attorney General was speaking. I got a chance to watch Lindsay do her great work, and my favorite part was when you had the thing about don't do those scam things. I mean, there was a lot of like stiff arm kind of this stuff happening. It was very clear. I think I understood. I don't sign, but I understood everything she was saying. So thank you again, Lindsay. We've got another executive order going out today, and this executive order sort of dovetails or piggybacks on one from March 26th. And that was one that the Attorney General had also helped us on, which was removing the requirement that counties must provide at least one physical polling place on primary election day, because this gave the counties the flexibility and local control to conduct their June 9th primary election by mail ballot only. 33 counties offer mail ballot voting already, but those were required. Those 33 counties that did mail-in also were required to have one physical. Now they can, if they opt in, they can opt in to have it not include that physical location to protect, of course, the safety and well-being of our poll workers, which include many retirees who may have greater vulnerability to COVID-19. Today we've got an executive order because a different one, because there's a different set in century code and different terms talking about school board elections. And school board elections actually start even before the June 9th. Some of the school board elections start as early as April 1st, yesterday, and go through June 30th. And this executive order today gives school boards the opportunity, if they want to opt in, to do mail-in only ballots, so they'll be able to continue to hold those. So that executive order went out just before 4 o'clock today. The other topic, another topic we want to talk about today, which again relates to insurance. Insurance Commissioner Gottfried was here yesterday presenting, but in a consumer-related issue. Blue Cross Blue Shield of North Dakota, the largest nonprofit provider of health insurance, has announced it is supporting the COVID-19 response by waiving all out-of-pocket costs for members needing inpatient or outpatient treatment for COVID-19. This is a big deal from Blue Cross Blue Shield, and this would include, when you say all, I had to ask again. I said, hey, does this include their copay? Yeah, this includes the copay. So the copay and all out-of-pocket costs needing inpatient or outpatient. They had previously announced they were waiving out-of-pocket costs for COVID-19 testing, but with today's announcement, which is effective through May 31st, applies to Blue Cross Blue Shield North Dakota members on fully insured groups and on individual plans. Blue Cross Blue Shield North Dakota is working with its self-funded employers to assist them in meeting the needs of their employees during the pandemic. And I just want to say again, as Attorney General was talking about generous North Dakotans, this is a very generous act by Blue Cross Blue Shield for removing some of the financial uncertainty during this crisis. And I also want to thank Insurance Commissioner Gottfried for pushing for this waiver. And as encouragement to other providers hearing this announcement, I'm sure that Insurance Commissioner Gottfried would encourage you to do, other providers to do the same thing and step up the way Blue Cross Blue Shield has. But for more information about their expanded coverage, you can visit the Blue Cross Blue Shield at bcbsnd.com/COVID-19. Next topic, we have put substantial orders and mandates in place about closing bars, restaurants, theaters, athletic facilities. The schools are closed, non-essential businesses are closed, and we've, asking people to limit their travel, stay at home, stay healthy, stay connected. But everybody knows we got to shop for food. But there are people that, for some people, maybe this is becoming the exciting, get out of the house entertainment for the whole family. And we've heard from the North Dakota Grocers Association that they would like to ask North Dakotans to, even though this is certainly shopping, grocery shopping is necessary and encouraged, that there are some guidelines that the North Dakota Grocer Association wants us to help get out, because these businesses can remain open and keep the important work they're doing as long as they're keeping their staff healthy. So whether you're a grocery store, a supermarket, a big box retailer with grocery services, we are hearing from all of them concerns that people aren't doing everything they can, the shoppers, to practice social distancing and protect their workers. These team members are there day in and day out. When the shelves are cleaned out during the day, people are working there all night long to restock those shelves. And of course, we know that there's exposure because of the concentration and number of visitors. The North Dakota Grocer Association has provided some solid guidelines. We strongly recommend everyone follow these for the health of themselves and for anybody working in these stores. Again, using sanitizing stations or wipes when available. Again, which we tell everybody, indoors or outdoors, maintain 6 feet of separation between yourself and others, whether that's customers and where possible with employees. Avoid social gatherings in the store. If you run into neighbors and friends here, the rules still apply about social distancing. Many people are doing a great job on planning their shopping trip before they're going, which is, putting together that shopping list to limit the time. You limit the exposure to others, and you protect yourself and your family by spending less time in the store. And then family members, again, doesn't have to be a group activity. Maybe a good opportunity to extend responsibilities to a younger member of your family and have them go do the shopping. Parents are busy parenting and helping their kids teach at home. So if you've got teenagers, maybe this is a good time to ask them to give them the list and have them go get this done one at a time. And I know this isn't possible, for families with young children. But again, if you can shop, just send one family member to shop. That's great. Number of people are using shopping for delivery or store pickup when available. Have it prepared, they bring it out to your car. We appreciate all the grocers that are doing those things to help that. We realize that with your electronic benefits transfer cards or food SNAP things, they can't be used for delivery fees, but some stores do offer free grocery pickup. And again, we do appreciate those stores that are offering senior shopping hours where they're limiting, they're open, but they're limiting to the public, to only those over age 65 to shop during certain times. We're doing this all together to slow the spread of COVID-19, but thank you again for following these guidelines, and please help keep yourselves and other fellow community members safe. Yesterday we had a question that came in from online where we deferred it back to the individual family about how they should manage the summer managing their kids in a co-parenting situation. I was made aware afterwards, we've shared this before, parents, probably a very challenging time to be parenting right now with kids home from school. And and all the pressures that are coming on families, but parentslead.org is a great website that's supported by our behavioral health division. There's lots and lots of information out there, and there's even a section on co-parenting during a pandemic. So it turns out our team already had information up on that. So again, kudos to behavioral health, and again, parentslead.org. If you're a parent, take a minute and check it out. Next topic, unemployment. Yesterday, we had another 2,806 unemployment claims filed. That brings the total over 30,000, 30,047 to be specific, since March 16th. So that continues to climb, and I know there are other announcements today, and I don't think anybody should be surprised about this going up. We've never had unemployment benefits like we have right now, and I think we're going to see a lot of organizations that are going to be furloughing employees and encourage them to pursue unemployment. So we should not be surprised if this number climbs at record levels either here in North Dakota or nationally. But the good news is that in many cases the benefits there are, well, and for sure in North Dakota these are the strongest unemployment benefits ever been available, because it's $600 a week on top of what was on prior a very good package before. Next topic, we announced on Tuesday our Workforce Coordination Center was activated to serve help with the emergency workforce needs in support of the COVID-19, because we know that we're stretched with lifeline services providers, industries, and agencies. And whether you're out of work, retired, or just want to help, we ask that you thoughtfully consider volunteering to help during this emergency situation. We're looking for both volunteers and paid staff. And the examples that have come up today, again, when we go out into rural North Dakota, we've got places where the city auditor plus one, they're the only two people that are there. I encourage them on the call to practice social distancing, because anybody knows in a small town, if you lose your city auditor, which it might be also effectively your city manager and your city everything, and they're answering every question for everybody, because city commissioners and mayors are part-times and their parents and have other jobs. So there's a broad definition of who's essential in North Dakota, and it really varies by community. But again, in this case, even if you're someone that's got an accounting background or you're willing to volunteer and answer the phone, if somebody had to stay home for a couple weeks and was isolated, your small town in North Dakota may need a volunteer to come and staff the phone at City Hall. So if you are interested in volunteering your services, whether it's in healthcare or finance, accounting, or anything you want to volunteer, go to the Workforce Coordination Center. And if you have needs, go to the Workforce Coordination Center as well. I'm pleased to report that in the brief time we've had this up, 330 people have already responded to our call for volunteers. And I think close to half of those are people with medical backgrounds. So we're off to a good start, but we would love to see thousands of people raise their hand, because we may need that kind of staffing to help us get through the peak. Interested employers and volunteers, contact Job Service North Dakota Workforce Center at 701-328-0400, or go online to jobsnd.com/COVID-19. Last update before we go to Q&A is today on a briefing led by the North Dakota Department of Commerce and Michelle Comer with a number of other elected officials from across the state and other cabinet leaders also participating in that. We had a chance to present information to over 2,200 individuals representing businesses across the state. One of the big topics on that call was something that we've already covered this briefing, which is the CARES Act. But again, $350 billion for support for small businesses, $260 billion for unemployment insurance expanded benefits, $300 billion in the form of those direct payments that we talk about, where basically every man, woman, and child in the nation under the income level is going to get a check, $1,200 for adults, $500 for kids, and then again providing guidance on on this whole thing, but today they also went deeper into the economic injury disaster loans, the Paycheck Protection Program, expanded unemployment and the direct individual payments. And if you weren't able to join in on the briefing, you can view it. It was a webinar. There were slides that went along with it. It's not just listening to a call, but you can view it in its entirety under ndresponse.gov under the Business Employer Resources section, along with the presentation resources. So if you missed that today and you're an employer, probably a really good idea, a great source of information there. The Commerce team continues to provide constant updates to its website as well to help you get the best information you can as an employer to make important decisions right now. The next briefing from Commerce will be Thursday, April 9th at 11 a.m. Central Time, and you can also register at ndresponse.gov. With that, we'll stand for questions, but I would say tomorrow we're moving the 4 p.m. briefing tomorrow to 3:30 p.m., so we'll look forward to seeing you here, but less conflict with potential White House announcements, which seem to be coming approximately at 4 Central Time. So 3:30 p.m. tomorrow, tune in tomorrow, and again, thanks to all the media that's here and listening online, but we'll open for questions. Dave Thompson from Prairie Public.
Governor, I've been getting a few calls, especially from central North Dakota, people who are trying to apply for unemployment benefits, and they're having some problems. They're saying they're getting kicked off. So I'm just curious, have you heard anything about technical problems to get on the site or anything like that?
And I'll just ask for clarification, Dave, when they're saying get kicked off, meaning they're
filling out the form, and then all of a sudden it crashes.
okay, so this is they're having problems applying online. So have not heard that, but I will, we'll take that. My team is here taking notes. We'll check in on that one, but thanks for that. Thanks for that feedback. And again, we are also working to try to up the staffing that's going on over there. Again, we're shared with you that we've had a year and a half's worth of applications in the last 16, 17 days. One coming in from online.
April Baumgarten with the Forum in Fargo-Moorhead. NDSU announced it has a presumptive case. Do you recommend any further actions to prevent spread at universities and colleges?
Well, whether it's if we have a presumptive case, whether it's in a business or anywhere in the community or at a university, the action is the same. Someone who's presumed positive should self-isolate until they find out that they've got either a positive or negative result. If anybody who's had close contact with that presumed positive, then they should also be self-isolating until they hear whether or not the person that you're connected with or have had close contact with is proved to be negative. So that's standard practice for everyone regardless of location. Thanks for the question, April. Lane?
If all Americans are urged to start wearing masks, does the state of North Dakota just have those N95 masks, or do we also have a cache of regular masks that will work as well?
There's a two-part question. In the big if on the first part, if Americans are asked to wear masks, I haven't heard that that's going to be a national order. And then the second part is, I know that we've got still remaining N95 masks. I believe we've also got what are called surgical masks, which are not N95 masks. They've got little less protection. They provide some protection, but we would not have enough of those in a medical cache for everybody in North Dakota. But again, if you stay 6 feet away from everybody else, you don't need a mask. So that's if you don't like wearing masks, then keep physical distance. For medical providers that are working with people that are, for example, that are presumed positive, maybe positive, or have other diseases, that's where we've got to make sure that, for the first responders and the medical providers, we've got to right now make sure the equipment goes to them because they're not able to do their job and stay 6 feet away, and they're in regular contact with people that may possibly have COVID. So we're concentrating our resources where it can protect the people the best, and for everybody else, I said, skip the mask and stay further apart. Jacob?
Governor, in reference to the president, he said that he's expecting between 100,000 to almost 250,000 deaths related to COVID-19. Is there a number or a model your office is using, anticipating for this state?
There's a number of different models with, high, low, medium. We're still continuing to work those models. They're between those, but if you, North Dakota represents less than 1/3 of 1% of the population of the United States. So if you did the quick math on that, and you took 1/3 of 1% of 200,000 people, I think that gets you to about 600 deaths in North Dakota, and I think we would find that unacceptable. And so we're working really hard to make sure that we don't get there, because those assumptions are based on that we're the inability to provide the care that's needed for the people that are most critically ill, and so that's that's what we're working to do. We want to slow the spread, raise the line of the capability of the health crisis. But I should also be clear too that during this time period, there'll be, I'm sure, a postmortem after we get through this to say the people that died from COVID or the people that died with COVID, because we have people that are, if you're at near end of life and have multiple underlying health issues that are going on, each one of those multiple health issues, which could be fatal, whether it might be cancer, heart, or lung cancer, respiratory disease, any of those things that could be fatal for someone of that age, and then you throw this on top of it, it could accelerate mortality. And so again, I think we have to take a look at what's your underlying run rate, because over a period of the next year, there will be people that die in North Dakota, and what's our run rate going to be versus our baseline. And we may not be able to beat the baseline because people, we haven't figured out the path to immortality. So there still will be life, birth and death as part of the regular course of life in our state. But what we don't want to see is a big acceleration of mortality because we didn't do everything we could to do things that were controllable in terms of managing the spread of this virus. Another question coming in from online. And of course, we still have the Attorney General here as well. If people want to toss questions his way, he's still here.
Eric Arndt with KZZY in Devils Lake. Given where the numbers are today, does the state have any new projection of when North Dakota might see the peak in coronavirus cases?
The answer to that is no. We try to be looking at updating our models. We've got a big modeling meeting again tomorrow, but as we said earlier today, the 12 cases reported today came from a short stub period, so we're not updating our projections on peaks at this time. Lane?
The PPE supplies delivered to hospitals by the NDDOT, was that just to hospitals, or is that also being sent out to first responders as well?
I'd have to drill down on that specifics. The briefing that I got was that it went to the 49 hospitals in North Dakota, but I know that we also have been through a regular purchasing system, have been delivering, maybe not by semi, but we've been delivering to police departments and sheriff's department and first responders around the state, and worked on getting some of the kinks out, because in some cases we were trying to make sure that the people purchasing, we made that announcement a day or two ago, that if you're in a county, have your emergency manager there who knows how to do the purchasing for emergency managed supplies, have them do the purchase order with our emergency management team, and that's how we'll manage getting it out. But I believe that the semis went to hospitals only, but we still are doing deliveries to first responders and law enforcement in smaller quantities than hospitals. Dave?
We talked about child care a few days ago, and there was some concern that you're losing child care providers. You've got new rules coming in, but there's also some new federal money coming in. Have you stemmed the tide of losing child care providers? And I'll preface this by saying there was a big announcement from the YWCA in Fargo this week that they're closing down their child care center.
Yes. Did we stem the tide? The answer is we believe yes. We had dropped out of over 1,600 private owned and operated child care providers. Some of those, of course, are nonprofits like the one you mentioned, but we had lost 174 of them in the first couple days. Since this, that number has gone the other way. We're back. We think the number I heard today is there's only 154 that are closed, and of course that's their choice and their option to do that. But we feel we've stemmed the tide. Today at the Emergency Commission meeting today, there was a vote to approve $6 million in community block grant capability that is coming in through Human Services, which could be directed or will be directed towards child care in our state. So that is a source of funding that could help support the child care emergency operating grants, which we announced earlier. But again, we feel that action that was taken, helped at least for the moment stem the tide of those closures, because it's an essential piece of infrastructure that we need all the time in our state, but we absolutely positively need it to get through this crisis, because we got to have child care for all of our lifeline workers. Jacob, KFYR, thank you for being here again. Still got perfect attendance.
Governor. This is a question for the Attorney General, actually. You mentioned the generosity of North Dakotans, but you also said that charities are suffering. Wonder if you could add some context to what you mean by that.
Well, everybody's income is down, and the disposable income certainly, and that is the source of money that most people have to make donations to charitable causes. And so as income goes down, the economy suffers, the ability of people to make donations is depleted as well. And I'm sure that any charity that you talk to, and I don't want to mention Prairie Public Radio in particular, but I'm sure that they're experiencing the same kind of thing that I'm seeing or hearing about happening everywhere. Just the donations are going to be going down because people's income is going down.
We'll go online and then to Lane.
Okay. Robin Travers with 660 KUIZ in Williston. How can the government help to make sure voter turnout is high for elections given the new executive orders?
On how can we assure turnout is high on these local elections? Again, the burden, particularly on school board elections, really is on the local schools. And so if they're going to mail-in only as an opt-in option that they have for a school board election, that, local newspapers, social media, all the marketing methods they do to do that, because sometimes you've got, there are school board elections that have happened in North Dakota with pretty low turnout, but because it may not fall on a normal election day, people may not be clear on where to vote. So again, would encourage everyone to do that. And certainly if you've got students that are at home, making sure that the parents of those kids who ought to have a voice in this thing, that they know that those elections are coming up, property owners that are paying property taxes that are supporting those schools. So I would think, maybe the county tax department, the schools, working through their kids, but it's possible with, sometimes these school board elections were held at a time where maybe it wasn't convenient for working parents to get there to vote. In some cases, we've seen when you go to online mail-in balloting, you can actually get voter turnout up versus down. So it doesn't necessarily have to mean that we're going to have lower turnout. It could actually increase because it could make it more convenient for people, particularly during these challenging times. And if people are working from home, everybody should have time to fill out a mail-in ballot, because you're saving all that time that you're not commuting every day or dropping kids off at school. So would encourage all those local political subdivisions to really get the word out, particularly if they're going to mail-in ballots for the first time. It's really incumbent on them to get the word out. Lane?
The White House has urged rural areas to listen to the information because they're not invincible as well. Do you feel like North Dakota has done enough to inform these rural areas, or do you think there's more that could be done for them?
I think we've still got some work to do, and I mean, media's been great covering these daily conferences. We're putting stuff out on social media from the state, but you can be a state, any state in the nation right now is doesn't match the hundreds of millions of people that are on social media every day, often spreading misinformation on all range of things. And it's just, everything from people, saying that this thing may not be real. There's still stuff like that floating around on social media in North Dakota, shockingly, as Americans are, dying every day. So it is. It is, again, and I've put the appeal out on all these calls, whether it's talking to bankers, whether it's talking to business leaders today, whether it's school board members, whether it's the local medical community, the local hospitals. Everybody's got a responsibility to try to communicate to their constituents the importance of this, and that it really matters, that by practicing the guidelines that we're giving and following the executive orders we've put out, we are gonna save lives. But I do think it's easy to look at a map and go say, hey, we don't have any positives in our county, the rules don't apply to us. But again, I keep saying I wish we had another measure, and maybe we will soon as we ramp up testing. Some of the ideas that we are planning on doing for testing that I think might help the whole country, if we can get federal support for this, is for us to go do large-scale testing in a county that has no reported positives. And if we can go into a county like that and demonstrate that there are a number of positive cases that just weren't showing up or they were asymptomatic, we think that's information that could help every model in every state in the country and maybe the whole world. We think North Dakota could actually contribute to the world's knowledge because the majority of the testing resources are going towards the places where we're in full-on outbreak, like the Washingtons and the Louisianas and the New York. Those are the people that have the highest number of tests per thousand, because the federal government's shoving a lot of testing resources there to try to just stop, slow down the onslaught that's happening. There's and so we're, but we think, again, if you're trying to reinforce success and educate the world, that there's a real opportunity for us to lead with some new knowledge and new information. But to do that, we've got to have more testing capability than what we have right now. And we had a couple of machines arrive yesterday, the Abbott M2000s. These are significant, huge machines. They got National Guards over at the health department helping that team over there get them set up, and we should have those online. They have to get verified, could be online by this weekend, but we're doing a lot of things to increase our throughput, and with more data, we should be able to do a better job of educating the public, even in the rural areas, that this is super serious. Dave?
For this one, when it comes to social
Nervous.
media,
You're asking for forgiveness before you even ask the question, but
when it comes to social media, should we practice social distancing?
okay, we'll just leave that one as a standalone. Dave Thompson.
That you're talking about, those are the ones that may be a quick turnaround test?
No, Abbott ID Now is the ones that can process a test in under 15 minutes. The M2000s are big batch machines. I think they do 94 tests at a time, but those, and we'd like to have those up and running, and if we've got staffing, it'd be great to have those going 24 hours a day.
Last one from me, Governor. Yesterday you extended the business closures and whatnot. With the North Dakota Grocers Association announcing new guidelines, just any consideration of expanding the types of companies that would fall under that closure in the coming days?
No plans right now to expand the closures. We would just, again, encourage everybody to follow the orders we've already given, and then again, exercise individual responsibility. If again, we've talked to the mayors. We know some mayors have felt like, hey, maybe they should be doing more to try to shut some things down. We've encouraged the mayors around the state to just amplify the messages we're delivering. We think we've got enough government mandates out there right now. We just got to get everybody to follow them. And if they can follow, particularly as it relates to what individuals are doing in terms of distance keeping and staying healthy, staying home, staying connected, if they can do that, we can maybe get through this without having to dial up more government interference in the lives of people. That would be nice if we could do that, but it all depends on the state. I think a great outcome would be if we were one of the states that had a little lighter touch on the mandates, but we had some of the lowest and slowest spread, because that would mean that we're still living in a country where individual responsibility matters, and as opposed to, hey, mayor, won't you do it? Hey, mayor, if you won't do it, maybe the state will do it. Hey, state, if you won't do it, why don't you get the federal government to do it? Maybe we can get the I'm hearkening back to Star Wars, but the supreme leader, maybe the supreme leader of the world, of the universe, could put out some orders. No, come on, it all comes down to the way you stop the spread is what the choices that individual people make. The spread in North Dakota is not going to be determined by what's said in Washington, D.C., and it's not even going to be determined really by what's said in North Dakota. Or in Bismarck, it's going to be determined by the individual responsibility of North Dakotans. So if we can deliver on that consistently, that could be a real feather in North Dakota's cap. I think there must be new news coming in. The Attorney General's got a hot piece of news in his hand.
Well, the first news is I want to make sure I understand now that I can go home and tell my wife that I am prohibited by law from going grocery shopping with her. Is that correct? No. And of course I'm kidding. I understand, and we both already understand how important it is to not congregate in the grocery stores or elsewhere. I just want to give an update because I mentioned this woman that had lost the $9,500 who called our office because she had heard in the media that the Publishers Clearinghouse scam was indeed a scam. After that, we contacted the sheriff down in Texas where she had mailed the check, and the sheriff went out to the house, got the envelope with the check in it, and the lady is going to get her money back. And so that's why it's so critically important to get the message out, because if she hadn't read that story in the newspaper, she would be out $9,500. And so please help spread the word as much as you possibly can. And one other thing, Jacob, I wish in the context of things I wish I had said, the North Dakota Medical Foundation, who runs the Giving Hearts program, did a survey of a number of charitable organizations in North Dakota, most of whom said that they had canceled a charitable event of one sort or another that they had planned. That's some evidence. I think there's some information you can get from their website that talks about some additional difficulties in getting charitable contributions. So there was some valuable information there. Thanks again, Governor, for having me down here. I appreciate it.
After that happy ending, we're going to have to call you Paul Harvey for the rest of the story. They've recovered the check, so that's fantastic. It's the top of the hour. We're going to close out. I want to say again, thanks. Another example of media getting the word out, helping citizens in North Dakota. So thank you for that. Thanks for everybody that's tuning in. And again, key messages here about North Dakota Smart means stay home, stay healthy, stay connected. Stay connected means keeping your kids connected with their teachers, stay connected with your child care providers, stay connected with your parents, grandparents, and friends and relatives, because we all need to look after each other with a little bit of extra patience, a little extra kindness during this time. There is a old proverb that says, don't be pushed by your problems, be led by your dreams. And I think that even in this time when everybody's probably feeling like we got a stack of problems behind us, there still is an opportunity for us to have dream about outcomes. We've tried to outline some of those here today about how North Dakota can come through this better and stronger with the full resolve and the full capability that we'll